Welcome to Module 1, Chain of Transmission. This is the first module in the training program developed in support of the Best Practices document on environmental cleaning for prevention and control of infections in all healthcare settings, developed by the Provincial Infectious Diseases Advisory Committee. Healthcare settings are encouraged to work towards best practices in an effort to improve quality of care. My name is Grace Volkening. I am the Network Coordinator for the Central Region Infection Control Network, and I will be your presenter for this module. At the end of this session, you will be able to explain the importance of environmental cleaning, describe the general principles of transmission of infectious agents, and suggest some strategies to break the chain of transmission. Healthcare-associated infections occur as a result of healthcare interventions in any healthcare setting. Healthcare-associated infections are a client-resident-patient safety issue and represent a significant adverse outcome of the healthcare system. The environment around the client, patient, or resident influences the incidence of infection. We know that cleaning and disinfection reduces the numbers of microorganisms or germs in the healthcare environment. The goal of cleaning is to keep the environment safe for our clients, residents, patients, staff, and visitors. All of the infection prevention and control strategies, including environmental cleaning, are aimed at breaking what we call the chain of transmission. First, it's important to understand that infections don't just happen. A series of well-defined circumstances or conditions need to be in place for an infection to occur. As mentioned, this is referred to as the chain of transmission. Interestingly, we do have some control in preventing infections, as there are a number of strategies targeting each link on this chain: the infectious agent or the germ, the reservoir, the portal of exit, the means of transmission, the portal of entry, and finally the susceptible host, which is the last link on the chain. The first link on the chain is the germ or the infectious agent. Microorganisms or germs are everywhere. They can be bacteria such as MRSA or Clostridium difficile, viruses like influenza or hepatitis, and to a lesser degree, parasites and fungi. The next link is the reservoir. This is the place where an infectious agent may live, waiting to be transmitted to another person. The most common reservoirs in the healthcare setting are people. They can either be people with known or suspected infections, or individuals who are carriers of germs but are not sick. Food and water are other reservoirs, as are animals such as visiting pets. Not all clients, patients, and residents in our facilities have symptoms of infection. You cannot always tell by looking at someone whether or not they are infected or are carriers of disease or infectious germs. Likewise, just because something looks clean does not mean that it isn't contaminated with potentially infectious germs. Germs are not visible to the naked eye, and these same germs are the ones that can be carried from room to room on our hands, gloves, uniforms, or cleaning equipment. The next link on the chain of transmission is what is referred to as the portal of exit. This is the way that an infectious agent gets out of the reservoir. The portals of exit in humans include the respiratory tract, the genital and urinary tracts, the intestinal tract, our skin and the mucous membranes of our eyes, nose, or mouth, from mother to child across the placenta, and through our blood. Here is our first learning checkpoint. Which of the following are reservoirs for germs? An individual with a cold, an outdated cleaning solution, visiting pets, or all of the above? The correct answer is D. All of the above are reservoirs for transmission of germs. There are a number of ways in which germs can get around. This is referred to as the means or mode of transmission. This is an excellent depiction of how large droplets from a cough or sneeze find their way out through our respiratory system. The most common mode of transmission, and especially in the healthcare setting, is through direct and indirect contact. For example, the hands of healthcare providers contaminated by direct contact with patients, residents, or clients, or indirect contact with their environment or equipment. If I clean the bathroom of a patient, resident, or client with Clostridium difficile, I can carry C. difficile spores on my hands or gloves to the next person or room. Then I need to carefully remove the gloves and perform hand hygiene before going to the next bed space. I may also indirectly transfer C. difficile to the next person if I do not clean and disinfect shared equipment such as commode chairs between patients, residents, or clients. Some other examples of germs spread by contact include MRSA and VRE. Droplet transmission occurs when large respiratory droplets created by coughing or sneezing travel approximately 2 meters or 6 feet through the air and deposit themselves into the eyes, nose, or mouth of another person. They can also land on an environmental surface on which we can contaminate our hands. Influenza is a good example of a disease that is transmitted by these large droplets. In airborne transmission, smaller particles, such as those produced by a person with TB, generated by coughing and sneezing, are suspended in the air. Anyone breathing that air may be at risk for that infection. Some examples of diseases which are transmitted by the airborne route include tuberculosis, also referred to as TB, chickenpox, and measles. Vehicle transmission occurs when items such as food, water, or other substances, for example medication, are contaminated and multiple people are exposed to the item. The best example I can give you is that of the Walkerton outbreak, where many people were exposed to contaminated drinking water and became ill from E. coli. In the healthcare environment, used cleaning cloths, commodes, bed rails, and shared equipment such as blood pressure cuffs or stethoscopes are common vehicles. Some infections can be transmitted by insects, such as the mosquito, which can spread West Nile virus, ticks, which can spread Lyme disease, or the tsetse fly, which transmits malaria. The next link on the chain is the portal of entry, or the way in. Human portals of entry include skin that is broken, including rashes and cuts, the mucous membranes of our eyes, nose, and mouth, our respiratory system, the intestinal tract, and genital and urinary tracts. Here is our next learning checkpoint. What is the most common mode of transmission for infection? Is it droplet, airborne, contact, or respiratory? The correct answer is C. The majority of infections are spread through direct and indirect contact. The last link on the chain is the susceptible host, which can be the next sick person if we do not break the chain at one of the earlier links. The susceptible host is anyone who lacks immunity or has reduced resistance to a particular infectious agent. For example, if you have had chickenpox before, you are not likely to contract chickenpox again, We could say that you are immune to chickenpox. If you have been vaccinated against hepatitis B, you will not acquire hepatitis B if you are exposed to it. If you have received your annual flu shot, you are less likely to become ill with influenza. Important host characteristics that can affect whether or not you will acquire an infection include your age. The very young or the very old are more vulnerable to infection. Whether you've had an illness such as chickenpox, measles, or hepatitis A, each of these diseases provides long immunity after illness. If you are diabetic or receiving cancer treatment, you are more susceptible to infections. And generally speaking, a healthy lifestyle can help prevent acquisition of infection. They say a picture speaks 1,000 words. Have a look at this picture. Consider what this picture tells you about the chain of transmission. When you return to your job, what will you do differently as a result of this session? Make a list of 3 things that you think you will do differently. This concludes Module 1 on Chain of Transmission. Thank you.